Production funding is provided by A. Reddix and Associates, Health Information Resource Center, offering short-term training for long-term professional careers in medical coding. HIRCVA.net.
Discussing the issues and celebrating the successes of the African American community. This is Another View.
Hello everyone, and welcome to Another View. I'm Lisa Godley, filling in for Barbara Ham-Lee. Our topic this week is one that's near and dear to my heart. I recently had a cousin, just 19 years old, pass away following an asthma attack. It really stunned me to learn that people are still dying from asthma in 2011. So I started doing some research, and I discovered, like many illnesses and diseases, that when everyone else catches a cold, the African American community gets pneumonia. According to the Office of Minority Health, African Americans are 4.5 times more likely to visit the emergency room because of an asthma attack, and almost 3 times as likely to die from one. Joining me to discuss this important issue are Dr. Melvin Johnson, an internal medicine physician who treats quite a few asthma patients, Elena Adams, whose son is now a hemiplegic following a series of events that started with an asthma attack, and Cynthia Odom, who's with Eastern Virginia Medical School's Healthy Homes Project. They look for things that trigger those asthma attacks and knock them out. Welcome, everyone, to Another View.
Thank you.
Dr. Johnson, I'm going to start with you and with the basics. Explain what asthma is and how it affects the body.
Okay, asthma is a chronic disease heralded by a inflammation of the breathing tubes of the lung, what we call the airway, usually the small airways. It is also accompanied by a over-response or over-activity of those airways, leading to the development of closure of the airways to some degree, the development of increased manufacture of fluid or mucus in the lungs, heralded by the symptoms of what you describe as wheezing, as well as shortness of breath. It tends to be a reversible disease in its early stages, and then as it progresses through the individual's life can become a chronic disease with irreversible components.
Why is it you find that sometimes in families, one person may have it, one not? Is it hereditary? How does that work?
There is not a clear linkage with hereditary or it running through a family. Certainly, various individuals within a given family can be sensitive to certain things that would trigger their asthma off. We do know that there are lots of external factors that will influence the appearance of an asthma attack, or will mediate an asthma attack, or will aggravate an asthma attack. But there is not a clear linkage. But certainly, particularly children exposed to certain irritants will develop asthma attacks.
Your thoughts on why it's so disproportionate when it comes to African Americans as far as the severity?
Well, there are a number of issues that tend to affect the African American population, but more specifically children and adolescents. And many of these in the category of what we call socioeconomic situations, but more especially related to environmental factors such as pollutants, such as things like cockroaches, dust mites, smoking, things like that tend to be more prevalent with the African American population and children.
Okay. All righty, thank you. Now, Elena, your son, Dante, prior to his asthma attack, was a very active young man. Tell me a little bit about Dante.
He played music instruments. He wrote poetry. He was just like an average teenager.
Okay. And what transpired the day of his asthma attack? Did he have his inhaler with him?
No, he forgot it at home. And he went to the store. And to this day, we don't know what triggered it, because there's so many things that could trigger it. And he just collapsed. And
what happened after that?
Well, after his asthma attack, he started having grand mal seizures, which they say was caused from lack of oxygen. And then he end up having a stroke. And then that caused bleeding on the brain, which caused them to do surgery, which he ended up in a coma. So he was in a coma for like 3.5 months.
Okay. And how is Dante doing now?
Oh, he's doing wonderful. Okay. They thought he was never going to be able to walk or eat, or they thought he was, you know, brain dead, which I brought him home and we worked on it.
Okay. All right, thank you. Cynthia Odom.
Yes.
What's going on at EVMS? We followed you around one day and saw you going in. Tell us a little bit about the program and how it started.
Okay, it's called the Healthy Homes in Norfolk program. And as you said, it's at EVMS, Department of Pediatrics. We're in Community Health and Research. We work with Dr. Cynthia Kelly in the allergy clinic at CHKD. That's where we get all our participants from. We recruit children from ages 5 to 13 who have asthma and allergies. We contact the parents, enroll them in the program. We do an intake either in our office or we go to their homes, and you came to us when we went to the home to do the intake. During the intake we do a baseline survey asking them about the asthma, about the child and everything else. Then we set up a home environment assessment where we go and we do air quality, dust samples, look at remediation items, which is mainly my job here, what I do. Remediation and assessment coordinator. There's three of us on our team, the Asthma Busters, as we've been dubbed by the Virginia pilot, Lisa Newman and Sharon Williams. And what we do is we go to the homes. There's a baseline home environment survey that we do, and that's asking about different things in the home. Mold in the home, mildew. We look at windows to see if there's any mold, the shower curtains, see if there's a vented stove, if there's a vent in the bathroom. Moisture causes mold. We look at the child's bed, the bedroom and the kitchen. We look around those different areas. Actually, we look at the entire house, but we're trying to find things that trigger the child's asthma and allergies. I make a list of remediation items, things that we can do to help. And after we get approval for all that, then what we do is we go back in home. Lisa and Sharon are the home health specialists, and they go back each time, and whatever we have written up to use for the asthma triggers to help, they will be bringing it back and doing education with them. So there'll be 4 visits, and each time they go back, they'll be bringing something else. When we do the remediation, we take samples. I have an air quality machine, IAQ 5000.
Is that the one that looks like the vacuum cleaner?
No, the little one I had.
Oh, okay,
yes,
all right.
Monitor. I take carbon monoxide, carbon dioxide, humidity, and just temperature readings. They take dust samples using just a regular vacuum, but we have a filter that we have from Indo Biotechnologies. And they take samples of the kitchen around the floor and the child's bed. So we're trying to see what's in there and what's in the home.
How many homes are you trying to reach, and how do you choose who gets to participate in the program?
They have to have asthma and allergies, and have to be between those ages. And they have to consent to be in a program. Everyone doesn't want to do it, believe it or not. We're trying to help them. We are looking for a total number of 135, and the program goes through 2013. Right now we're at number 19. So we're slowly moving along.
Okay. All righty. Thank you so much. Dr. Johnson, what can we do as the general public when it comes to looking out when someone in your family has asthma and something's going on? Well, my cousin had her asthma attack. She did not have her inhaler with her, and I spoke to someone just recently. A friend of mine told me, she said they're so expensive. They can be, over $80. What do you do when, what do you do to help in these situations?
I think the biggest thing is, one, is education, is getting information out to families, out to the general public in various venues. We have to be sensitive as to how people receive information. Believe it or not, the average public does not read the newspaper as we think they do. They watch a lot of TV. They watch a lot of other things that are not necessarily good information sources. But recognizing how people receive information, getting information out, and in addition to that, trying to publicize resources that are available to people with certain particular illnesses. And there are lots of resources, but it's a matter of knowing where to find them, how to dig them out, and how to utilize them. In addition to that, when you talk about medications, some of the pharmaceuticals do have assistance programs that you can apply to get medications. And it is very helpful for those patients who are struggling to meet that financial need to purchase their medication.
Now, are some age groups more susceptible to this than others?
I would tend to think that particularly small children are more susceptible for a couple of reasons. One, the small child is probably more intimately connected to mom and dad than any other children. The second thing is that in the area of asthma, their lungs are still growing, still developing, and are so easily affected by things that they may inhale and things that they may be exposed to.
What are some of those symptoms we should be looking for in those small children when they...
Very often what you will see is a child who tends to not be as active, a child who tends to be having difficulty breathing, a child who tends to change their usual habits, doesn't want to go out and play, doesn't want to go out and participate with things like that. And one needs to be sensitive to that.
Okay, we've talked about some of the things. What are some of the other things that maybe we haven't spoken about that could trigger?
My big focus is on smoking.
Okay.
Okay. And I noticed that she did not mention that as one of the big things. But when you look at just that one factor in terms of a trigger for asthma in children, it is very startling. When you stop and you look, for instance, at educational level, if you look at families in which the parent just has a GED, approximately 44% of them across the board are smokers. When you look at families in which the parents have a college degree, that drops down to about 21–22%. When you look at families in which the parents have a postgraduate degree, that figure drops down to about 7%. Mm-hmm. That is startling statistics when you talk about adults who smoke in the house and small children being exposed to that.
Thank you. Elena, did Dante have any symptoms prior to being diagnosed with asthma?
Well, he actually had his first asthma attack when he was 2 weeks up.
Wow. Wow.
He went into respiratory failure.
Very young. That is very young. Did you know that that's what it was? Are you at that age, or had they told you something
Well,
similar?
I kind of felt that's what it was because it runs in my family. Mm-hmm. So.
Okay. All right. Cynthia, you were talking about mold, for example.
Okay.
If someone notices that in their home, and I know you all take care of some of the things. I know when we were at the home, you were talking about replacing the child's mattress in the home. What do you do when you have mold in your windows or dust mites?
When the two ladies go back to do education, they will show them how to get rid of the mold. They will do basically detergent and water, or dish detergent and water will clean it up. First you have to wash it with that first and scrub it. Blow dry it with a fan or something, and then use chlorine bleach. 1 cup of bleach to 10 cups of water, and just scrub it good, and that gets rid of the mold.
Okay.
Now, and as simple as that, but people don't know that.
Now, I don't have a machine like you did, but like, for example, dust mites, you can't see them, so how do you know if your home even has dust mites?
Dust mites are everywhere. They're everywhere. We're probably sitting. You can't see them. They're everywhere. But they thrive in humid conditions. You know, where there's humidity, the more humid places, the more dust mites there are going to be.
You know, well, one of the things that you can do with that is particularly if you have a child that's sensitive and you're aware of that, even if you don't prove that you have dust mites, is to cover the mattress with plastic.
Oh.
Okay.
We don't use plastic.
You don't
we use
use
the dust covers.
Okay,
we
dust
give them
covers.
those dust
you call
covers.
them dust covers.
Yeah, the dust covers.
But those you can
plastic.
clean. Okay, those you can clean, and then you can take the linen off the bed and make sure you clean that on a regular basis. Yeah. But you can cover the mattress.
Yeah, we provide those with a micron of 5 milligrams.
How long is that interview process, Cynthia, when you ask, and what kinds of questions are you trying to find answers to?
For the home environment assessment?
Yes.
Well, we're asking how old the home is. In each room, there's different questions. Everything else isn't questions. Remember, I was going on visually inspecting things. For instance, I was looking at the windows to see if there were any roaches, any roach bodies, and seeing if there's any condensation on the windows, which would indicate there's moisture coming in. And mold as well. One of the houses we went to was mold. The window, the child's room was full of mold. The window was just needed to be totally replaced.
How many days during the past 14 days did you have to change it?
We asked about when was the last time they sprayed, or do they spray if they're roaches? Because that's not good for the child with asthma. We provide combat for that. We don't give, we try to discourage them from using sprays, aerosol sprays. We also give them vacuums with HEPA filters.
Now you said aerosol sprays. I don't think a lot of people knew that might be something that might cause a problem.
Exactly, because they can ingest it. It goes into their lungs. It's not good for them. Any kind of spray, it's not good for a child that has asthma.
Wow.
So we give them combat for roaches if they have them. We give them a vacuum cleaner with a HEPA filter. That means that everything that they're picking up is going into the filter, as opposed to most vacuums. It just goes back out into the air.
Oh,
it captures 99.9% of the dust and everything else.
So we should be looking for vacuum cleaners
with a HEPA filter. Exactly.
Okay.
Well, most vacuums now, when you go get a new filter, the HEPA filters now. Because I had one at home and I went to replace it, and they're only selling HEPA filters for my vacuum now. So people are learning and understanding that that's what you need to do. And it's already mentioned that we give the dust covers for the mattresses, also a pillow and a pillow cover as well. We give them a doormat when you come in the door. We try to tell them, have people wipe their feet on the mat, especially the ones that have the scrapes, because people are bringing things, tracking things in your home.
So those doormats do make a difference.
Yes, they do. Some people, we tell them take their shoes off. They're tracking things in your home that affect your child's asthma.
Wow.
What else?
I was going to ask Dr. Johnson a question. What are the common types of medication that are out there for asthma patients?
That is a field that is constantly changing. As we now look at it, we advocate the use of inhaled corticosteroids early on in the treatment, primarily because so much of the asthma that we see is an inflammatory response, and the corticosteroids really do address that. Okay? Outside of that, on an acute daily basis, we recommend what we call the inhaled bronchodilators. And those tend to be, for the most part, albuterol.
Okay.
And they come in various, what we call handheld inhalers.
That's what you see all the kids with.
That's what you see all the kids with.
Okay.
Now, one of the things that we have to confront in our society is the ability of a child to be able to take medication at school. That's an ongoing issue that those of us in the medical field have to try to educate and find ways with the school system to allow that.
Okay. Now, is Dantes still using his asthma medication? Okay.
He used the nebulizer and the albuterol pump.
Okay, all righty. I'd like to ask each of you, we're getting close to being out of time, and I'm just gathering so much information. But I want to ask each of you if you could tell our audience something really briefly about what you would tell them about asthma, or something you feel from your heart that they should know. We'll start with you, Dr. Johnson.
The thing that I would say is that because one treats an acute episode and the child or the person now feels fine, that's only the beginning of managing it. Asthma has to be managed on an ongoing daily basis. The worst mistake to make is I feel better, I'm not symptomatic now, so everything is fine, and I don't have to use this medication anymore.
Okay, Elena?
Just be cautious and actually think about everything that you do.
Okay, all right. We got about 15 seconds, Cynthia.
I want to defer to what Dr. Johnson said about smoking. Parents don't understand that even if they smoke outside, the smoke is in their clothes. And when they go in the home, it's getting on the child, and it's not good for the child as well.
Thank you all so much. You've given us a lot of information and a lot of things to think about. I really appreciate you all being here. When we come back, a hometown girl takes center stage in the Civil War opera Rappahannock County. But first, here's what's happening in Hampton Roads. In just a few days, a new music theater piece will debut in Hampton Roads. It's called Rappahannock County, a look at life during the Civil War. And one of the singers taking center stage in this Virginia opera production is a Chesapeake native, Aundi Moore.
All right now, Froggy. Dr. Jesus, then take the case.
When we first met Aundi Marie Moore last spring, she was wowing Hampton Roads audiences portraying Serena in the Virginia Opera's production of Porgy and Bess. Now the award-winning soprano has returned home once more to bring a piece of American history to the stage in the Virginia Opera's Rappahannock County, the story of life in one Virginia county during the Civil War.
The character that I play as a slave, my first song is called Mine, and you know, of course the Civil War is about several things, but one of the things the Civil War was about was slavery. And so I say that, you know, my eyes, my ears, my head, my heart, they're all mine. And I can't believe that I might be free.
It's been a long road back to you.
By the end, we're free in that we get to marry each other, but they're still not quite as free as they would imagine. They're free, but they have no money, they have no land, they have nowhere to go. So that kind of confusion is also added into this element.
Since we last spoke with Aundi, she's been quite busy, not only entering competitions and winning awards, but performing in operas all over the world. And one of her favorite things about traveling is coming home.
To be home and to be back here with my wonderful friends and family, it's just a blessing. I told Virginia Opera they should keep me as a resident artist every year. Let me come here and do something.
Aundi has studied classical music since the age of 9. At the time, it was nothing she cared to share with her friends. In fact, she kept her talent hidden until high school. The Indian River High School graduate remembers vividly the day her friends learned she could sing.
I had just won a competition, and my principal, Mr. Fry, came into my history class, and, you know, I thought I was in trouble. I was thinking, you know, why is the principal visiting me? I was in 9th grade, and he was so proud of me, and that just really did something for me to make sure that, you know, I continued to go on the track that I was going.
From high school to college to performing operas in 5 different languages all over the world. What a ride it's been, and one that's far from over. The Chesapeake native's advice to any young person eager to take center stage is to persevere. Don't quit. It gets hard. I promise I have tried to quit every day. Like every morning I'm like, I'm quitting. This is it. I'm tired, you know, especially if I don't have any jobs or gigs. But you're going to have some rough times ahead. But once you do, just keep on, make sure you get up, dust yourself up,
dust yourself off and keep on going, because the door will open. You just have to be persistent, and you just have to persevere through whatever might unfold in front of you. And the other last aspect is you have to remember to live life.
You can see Aundi and the rest of the cast perform Rappahannock County now through April 17th at the Harrison Opera House. And that's our show for this evening. If you're not a member of WHRO, I encourage you to join. Basic membership is $48. Don't forget, you can watch all past episodes of Another View by logging on to our website at anotherview.tv. While there, be sure to sign up for our eView newsletter. That way, you'll know exactly what topics we're discussing right here each and every week. Barbara will be back next week along with our always exciting roundtable pundits as they discuss the topics you're talking about. We'll see you next time for Another View.
Production funding is provided by A. Reddix and Associates, Health Information Resource Center, offering short-term training for long-term professional careers in medical coding. HIRCVA.net.